Exploring the visual potential of orphan drugs. In this infographic, I use all 5 types of visual potential. Number potential is explored by looking at the rarity diagram that's included with the map. Each jurisdiction's maximum number of patients required to be an orphan drug is encoded using a mount-style encoding with little tiny patient graphics that have been borrowed from the relationship model. In addition, I show the numeric potential of the amount of orphan drugs that have been approved over time. This is shown by positionally encoding them along a line graph, and the same positional encoding is then used to show how important events along the timeline relate to the number of drugs that have been created. Location potential is explored using a choropath map that uses colors to encode whether or not a jurisdiction has exclusive or non-exclusive drug licenses. In addition, a symbol map has been layered over that shows how price controls and subsidy policies have also been adopted by various jurisdictions. These symbols are also copied from the relationship graph. The appearance potential of drugs is shown by having a molecule, in this case aspirin, show along with the definition of what an orphan drug is. In addition, within the relationship graph, exclusivity, R&D subsidies, rarity, and price control are all encoded with their own icon to represent what those policies are. Those icons are then further used within the location display to tie them back to their definitions. Icons are repeated in each of these in the location display so that a user knows what they are. The relationship potential between those individual policies is shown how they roll up into a national drug policy that is composed of its component parts. This roll-up is demonstrated by having a line connecting those icons to a national drug policy, and the independence of those national drug policies has been visually displayed by having the alignment staggered rather than connected in a traditional hierarchical diagram. Finally, the time potential of orphan drugs has been demonstrated by showing a historical timeline of events that have occurred that were important to orphan drugs and orphan drug policies. A line graph is shown in a traditional trend display that shows how new drugs adoption relates to time over time, and that timeline positional encoding is further used within the historical timeline to show how historical events connect back to the trend in new orphan drug adoption.